Hi, I'm a therapist who works with children and teens in Idaho, and I want to share with you how state privacy laws, the Idaho Department of Health and Welfare, and the professional organizations that govern therapy are requiring therapists to violate parent rights and harm children. When a child or teen shows signs of gender confusion, desperate parents come where? To therapists. But parents don't know that state privacy laws prevent us from informing them if their child 14 and up identifies as transgender. They don't know that the institutions that govern therapy define being transgender as normal, something that should be embraced and promoted in children starting as young as 3. They don't know that therapists who do not affirm a child or teen's gender transition violate competency standards and put their licenses and their jobs at risk. The bottom line is therapists need help from you, leaders and legislators, to protect children from this kind of harm. In my presentation, I will help you to understand how the therapy world is responding to the epidemic of children who believe they were born in the wrong body. This is often called gender dysphoria, but I don't want to get into diagnoses. I'm going to call it gender confusion in this presentation. Gender affirming therapy, which you see on your screen, is currently seen as the best practice. A multiculturally competent counselor is required to use this standard of care. Notice that starting from toddlers to adult, we have social transitioning. Then we move into medical transitioning, puberty blockers, cross-sex hormones, sex reassignment surgery. Then we have legal transitioning. In this presentation, I'm going to focus on social transitioning. This is the gateway. Once kids begin the process of social transitioning through gender-affirming therapy, research shows that they will continue on that path and then continue on with medical transitioning, puberty blockers, cross-sex hormones, maybe sex reassignment surgeries. The National Health Service in England has backed away from gender-affirming therapy and reinstated the importance of biological sex. Why have they done this? Because they have learned the hard way. Because too many children and teens have suffered permanent physical and emotional scars. The Tavistock Center that provided gender surgeries to children and teens has now been closed, and they are facing thousands of lawsuits. And yet, our Health and Human Services is doubling down, as are our counseling associations, on gender-affirming therapy. Why is gender-affirming therapy the standard of care when studies have consistently shown that 80 to 95% of youth resolve gender confusion by late adolescence if they do not receive gender-affirming care? My presentation will probe the questions of who, how, and why therapists are being pushed to help kids socially transition when the vast majority of kids resolve gender transition by late adolescence if they don't receive gender-affirming therapies. One of the most common arguments used to support social and medical transitioning is the risk of suicide. Desperate parents come to therapists and they're told, if you don't support your child in transitioning, they'll commit suicide. But even studies used by supporters of gender-affirming therapy consistently show that transitioning does not reduce depression, anxiety, or risk for suicide. In fact, a long-term Swedish study showed that people who medically transitioned were 19 times more likely to die from suicide than their control sample in the study. So in this presentation, I'm going to use several acronyms, and I want you to understand what they are. Idaho Department of Health and Welfare is IDHW. The American Psychological Association is the APA. The American Counseling Association is the ACA, and the National Association of Social Workers is the NASW. Now, we all believe in diversity and equality and having empathy and humility. But as you will see, these ideals have been weaponized to erase the biblical and biological concepts of male and female. I'm going to show some screenshots from the IDHW Optum Medicaid website and from affiliated websites. On the surface, the stated goals sound very admirable. We support equal protection under the law, and we abhor persecution of people because of their race or creed. But when I dug deeper into what the IDHW is promoting, I discovered a very dark agenda that went far beyond protecting civil rights. The IDHW Optum Medicaid website specifically states that diversity is more than race and ethnicity. It now includes sexual orientation and gender identity and expression. When the website states that its goal is to embrace and promote diversity, it is literally true that its goal is to embrace and promote the infinite ways that transgender children and teens express their gender. You'll see that the fine point in this slide directs you to the competency standards of the APA, the ACA, and the NASW. These trainings, through trainings and required ethical standards, IDHW advances the goals and beliefs of these professional organizations. People need to know what these organizations are promoting. This is a list of different gender identities and ways of expressing gender. This is offered by the NASW. The ACA tells us that the diverse groups that fall within the transgender agenda can live fully functioning and emotionally healthy lives. If a transgender individual is unable to have children due to medical transitioning, would you say that they're fully functioning? Is a drag queen male who dances erotically in front of small children fully functioning? Can you see the danger in the definition of diversity that's being promoted? When you understand the IDHW vision of diversity and inclusion and their commitment to embrace and promote priority populations, you'll understand why IDHW funded drag kids on stage. Many good people, many well-meaning businesses are supporting these, what is called priority populations. But as you can see, there's more going on here than just meets the eye. So notice the definition of humility in the right-hand corner. As I explored this concept, I learned that to have humility, I must abandon deeply held beliefs about the concept of male and female. I must ignore evidence of sexual grooming, and I must suspend my understanding of true science. Real diversity and humility to me are what I experience in my job as a university instructor. I teach parenting skills literally to students from all over the world, from every continent but Antarctica. In weekly discussion groups and Zoom groups, this diverse student population comes together and shares universally understood principles of parenting and what helps children thrive. Gender identity has been redefined and refers to an individual's deeply felt inherent sense of being a girl, a boy, a blend of male or female, or an alternative gender. Gender variance is a normal expression of human diversity, a normative life cycle event. Since being transgender is now considered a normal part of child development, if a child or teen comes to my office telling me that they feel deeply that they were born in the wrong body, I'm expected to support their concept of gender. Now, my specialty for the entire time I've been in practice has been helping girls to develop a positive relationship with their bodies, positive body image. It's an absolute truth that positive body image is the single greatest predictor of self-esteem for adolescents of different ethnicities. We know from true science that if we help girls to develop positive body image during puberty, we can help them to build resistance to eating disorders, self-harm behaviors, depression, anxiety, substance abuse, and risky sexual experimentation. Now I'm being told that it is healthy and normal for a child to hate their body. The IDHW Optum website provides links to research and training so that therapists will know best practices. So here's a slide to a training called Across the Sexual Orientation and Gender Identity Spectrum, a call to action. So some people identify as gay. I say I'm gay. Sometimes I say I'm queer. I'm lesbian. I'm pansexual, asexual. There's so many terms that it's hard to keep up, honestly, but just asking questions to people will enlighten you. So personally, I don't know all the terms, and the younger people are, the more terms there tends to be. And I just ask them, what does that mean? Because a term for me can mean something different than a term for you, okay. And as you can see here, between gender identity and sexual orientation, you have queer in both. So somebody could identify as queer as their identity, as like the gender they feel, and then as their sexual orientation. So the title of this training calls us to action. What action are we being called to take? To me, as a therapist, I'm being asked to promote this example of a diversity as healthy and normal. But can you see how confusing this would be for a child whose parents express this kind of identity? Can you see the chaos we have in families if therapists don't protect the definition of gender as male and female? Not only do the proponents of gender diversity want to promote a variety of genders, they want to promote a variety of genders in young children. When a child comes out as a different gender than their biological sex, it is thought that they're coming out as their true selves instead of the gender they were assigned at birth. Research shows that youth who transition young have had excellent results. They pass with greater ease and mature into authentic gender identities. The governed bodies literally believe that the earlier children are supported in their, quote, true identity, the healthier they will be. Therefore, it's expected that therapists will screen children and teens for their emerging gender identity. This presentation will show how that's happening in Idaho. This tool, called the Gender Unicorn, has been endorsed for use with small children by the APA. Here's a screenshot of a flyer that I received recently to attend a training. The training is to help me with LGBTQ youth. The training is to help me develop clinical strategies to support their sexual identity and their gender identity. So skills I'm going to learn is how to help them in the coming out process, how to help them develop support networks, Both of these tasks are essential in social transitioning. Here in this box, it says the class is going to help me to help LGBTQ kids and adolescents know that it's their right to be themselves. So in my understanding, telling a child that they have a right to be themselves, regardless of how it affects their loved ones or harms their bodies, fuels a sense of entitlement that destroys their well-being. But that's what we're being asked to promote. Here's another word from the IDHW website that needs to be defined. Every therapist knows that clients need acceptance and emotional safety to be a multiculturally competent therapist. However, we are going beyond what we normally understand as emotional safety and acceptance. I'm required to see the child's gender identity as a culture, like being Black or Asian. So when a child or teen presents in my office, I'm required to see him as oppressed by people who believe gender is defined as male and female. This screenshot from IDHW asks me to learn more about intersectionality from a woman named Kimberly Crenshaw. Kimberly Crenshaw, in this TED Talk, is described as a pioneer in critical race theory. She says that it's urgent for us to look boldly at the reality of race and gender bias. So who's driving the push to help kids transition, even though we know that the vast majority of kids will resolve gender confusion if they are not affirmed? What I've discovered is that real science and good therapy have been hijacked by a frightening political and social agenda. First, all of these definitions provided by the IDHW and their partners in the counseling associations are coming from the lens of critical race theory. Second, we are fighting a cultural revolution that believes children are sexual beings from birth who have a right to express themselves sexually, and this right should not be oppressed. This revolution promotes the idea that all forms of sex are equally acceptable and valuable. In my master's residency, 6 out of the 12 therapists in my cohort believed that sex between adults and children was okay if research supported it. Parents need to know that the laws that prohibit sex between children and adults are under stress. And they need to know the beliefs and the treatment protocols for the therapists that treat their children. So the Prade Foundation, based in Chicago, is a partner of the IDHW, and I'll explain more about them in a later slide. But these screenshots are from a training on the Prade Foundation's TCOM channel on YouTube. And I want to demonstrate that therapists are being trained in critical race theory concepts. The title of this presentation is Racial Justice in a COVID-19 World. You may not be able to see this, but the people in her screenshot are wearing Black Lives Matter shirts. And in this screenshot, you can see that one of the 3 pandemics is the pandemic of white supremacy. Many people don't know that Black Lives Matter is a huge supporter of the transgender agenda. Out of their 13 principles that comprise their Black Lives Matter at School program, 2 of these are related to sexual orientation and gender identity. Listen to what they say. When we gather, we do so with the intention of freeing ourselves from the tight grip of heteronormative thinking, or rather the belief that all in the world are heterosexual. We are committed to embracing and making space for trans siblings to participate and lead. We are committed to being self-reflexive and doing the work required to dismantle cisgender privilege. Could this be the action that we're being called to take as therapists? They always say that if you want to know what's happening, you follow the money. Parents need to know that billions of dollars are being used to promote the transgender agenda through social media organizations and organizations like Black Lives Matter and Planned Parenthood. They're being well funded by people who have lots and lots of money. What parents don't know is that our state is helping to fund this push with our affiliations with out-of-state nonprofit groups. So I want to specifically show you how the Prade Foundation is helping children and teens to socially transition here in Idaho. Organizations like this have goals that sound so promising. But do we really know what we're investing in when we invest with these out-of-state groups? Just by happenstance, we found that the Prade Foundation in their latest IRS Form 990 showed a negative asset liability ratio of 261,962. Just for information purposes, the primary work of this organization is to develop assessments. Here's some more screenshots from trainings that are sponsored by these people. This one is from 2022. This is what the presenter says. They say that to address one ism, you must address them all. I like anti-racism intersectionality perspective because it brings gender issues, heterosexist issues that are aspects of our identities. So every therapist knows that clients need emotional safety and acceptance, but I'm being required to see my belief in gender as inherently male or female as a character flaw, an ism like racism, sexism, heterosexism, and cisism. So what's sexism? Cisism is discrimination against individuals who identify with and or present as a different sex and gender than the one they were assigned at birth. It is a form of sexism based on sexual and gender identity and expression. This is coming from the National Association of Social Workers. Here's another slide. Obviously, therapists know that empathy is a critical part of building a therapeutic relationship. However, the definition of empathy has been weaponized here. Cultural empathy, which I think is so critical, says the presenter, it's been talked about is this ongoing consciousness about the interaction of power, privilege, and oppression in every circumstance. So in order to have empathy with a child or teen who has gender confusion, I must acknowledge my sense of power and privilege as a white heterosexual. I must see the transgender client as a victim of my oppression or others' oppression by anyone who doesn't agree with his or her choice. So here's the definition of cultural empathy and compassion in relation to children who have gender confusion, according to the ACA. The therapist is the midwife, assisting in the birthing, offering encouragement and support, but essentially witnessing the child's own birthing process. This statement makes it sound like leading a child down the road of transgender transitioning is leading them to the pot of gold at the end of the pride rainbow. But at the end of the rainbow, there is serious harm. Long-term suicide risk, even after transitioning, serious mental health disorders that don't get treated. This is very troubling because so many kids who are autistic are greatly overrepresented in kids who present with gender confusion. ADHD kids are very susceptible to presenting with gender confusion. There are side effects from the cross-sex hormones and the puberty-blocking drugs that can be permanent. Sadly, these treatments increase suicidality in many people. They worsen their psychiatric symptoms. There's permanent disfiguring of genitals and breasts and surgical failures and pain from scar tissue. I wish everybody could see the tragic photos of gender reassignment surgeries. It's not possible to truly transition to another gender. You're only imitating another gender. These people experience loss of sexual function. Not only does credible research show that the transgender push is a social contagion fueled by social media and peers. In Britain, they had a 4,000% increase in children identifying as transgender. Do we really think this is happening organically? Is this really what we mean when we say we need to be compassionate and empathetic? Is this love to help lead someone down this path? The Praed Foundation has copyrighted an assessment tool called the Child and Adolescent's Needs and Strengths, or the CANS, and it's being used with Idaho Medicaid children and teens. CANS is a 117 question assessment that therapists perform in addition to the already lengthy clinical diagnostic assessment that's required for therapy. Try to imagine a therapist getting through 117 questions with a child or teen. The CANS assessment has 4 questions related to sexual orientation and gender identity and expression. The parent consent form does not inform parents that their children will be asked these questions, nor does it set the limits on the age that the children can be asked these questions. So this first question relates to cultural identity. And notice that sexual orientation or gender identity and expression is considered a cultural identity. So my job is to identify the child and teen's many cultural identities, including sexual orientation or gender identity and expression. And if he's not connected to others who share this sexual orientation or gender identity and expression, it's my job to help him connect. So how would you feel as a parent of a mentally ill child to find out that your child's therapist was helping your child connect to a group that promoted drag kids on stage? This question refers to sexual development, and it says that the youth's sexual orientation, gender identity, and expression could be rated here only if they are leading to difficulties. Remember, they're considered normal. So since a transgender child's gender identity is considered normal, my role is to help the child understand how his gender identity is part of his healthy sexual development. I'm also supposed to assess if he's engaged in risky sexual behavior, which means sexual behavior without protection, or if he's a victim of sexual exploitation. This relates to an individual's view of himself as belonging to a specific cultural group, such as sexual orientation or gender identity and expression. So I'm supposed to find out, does the individual identify with any racial, ethnic, cultural group, and is there pressure on him to be something different? And I am to help him resolve any conflict he might have about this cultural identity that he's experiencing. So this final question measures stress when the child or teen's family does not support their new cultural identity. So it says racism, negativity towards sexual orientation, gender identity and expression, and other forms of discrimination would be rated here. So my role is to relieve cultural stress for the family by assessing if the family understands how they are discriminating and oppressing their child. And the question says, what does the family believe is their reality of discrimination? How do they describe discrimination or oppression? Can you imagine being the parent of a daughter who is planning to cut off her breasts? Can you imagine being told that your unwillingness to accept your child's choice constitutes discrimination and oppression? When children come out, families can be horribly fractured. It's devastating for parents, as you can imagine, and therapists are being required to drive the wedge between parent and child even deeper. Each of these 4 CANS questions helps a child or teen to step onto the path to socially transition into his or her new gender identity. We must close the gate to this path. We must not require therapists to use pronouns that don't reflect biological sex as required by the counseling associations. The worst part for me of the CANS assessment is the plight of parents whose child is being led onto an irreversible path of harm. And if they're over 14, it's without their consent. Because the assessment is designed to be shared with every system that supports the child, such as the school system, the juvenile system, the medical and behavioral health system, each system will now support the child in his or her chosen gender identity and expression. This literally puts the health and welfare of the child into the hands of government systems and takes it away from the parents. So the bottom line is therapists need help from leaders and legislators to be able to protect children from harm. And I want to share some ideas I have for this. I'm not the expert that knows how to make these become reality. I don't know all the legal stuff. But I do know that we need to bring good counseling ethics back. Number 1, we need to amend our privacy laws. The intent of the legislature, the stated intent, is that parents, children, and therapists collaborate on treatment planning. But we're trained that if a child's over 14 and they can legally consent to their own mental health, we can't tell the parents that they're transitioning if the child doesn't want us to. We need to protect the right of parents to refuse consent for their children and under to socially or medically transition. You see what's happening in other states where children are being removed from the home because parents won't consent. We need to protect the right of parents to seek professional counseling that aligns with their deeply held values. We need to protect therapists who don't practice gender-affirming therapies. There are other evidence-based therapies, and therapists need training in those therapies. Affirm the norm for human development as defined by the American College of Pediatrics, that an individual's thoughts need to align with their physical reality if they are to be healthy. This needs to be the standard by which we are working from. And as I said earlier, Britain has gone back to this standard. There are many areas where we need to have informed consent, and it's not happening. Parents and teens need to know the permanent harm caused by hormones and puberty blockers. way before they get into medical transitioning. They need to know at the very beginning as they enter the path of social transitioning. They need to know the persistence of suicidality even after transitioning. They need to know the permanent irreversible harm and the poor outcomes of gender reassignment surgeries. They need to know the high rate of children and teens who resolve gender confusion if they do not transition. When kids feel these things, they're told that this is permanently who they are. It's not permanent unless we make it that way for the vast majority of people. They need to hear the stories of individuals who detransition, who regret their choice. Similar to showing a woman who wants an abortion an ultrasound, letting kids see other young people who have gone through this path and regret their choice and are trying to detransition. That needs to be part of our informed consent. We need to have full disclosure about the therapist's approach, and we need to protect the therapist's right to disclose her approach if she is not a therapist who's going to use gender-affirming therapy. And I feel we need to allow parents to sue professionals, doctors, mental health practitioners, and teachers for damage if their children are socially and medically transitioned without their knowledge, especially. So I hope this is helpful and lets us know in our state, we are at a crossroads and we must protect the environment that our children are being raised in. And we must choose principles that help them thrive. Thank you so much for listening.